This video includes comments from a panel session hosted by the California Professional Firefighters, the California Fire Chiefs Association, and the Fire District Association of California. In it, you will hear from some fire service members in a discussion facilitated by my colleague, Dr. Deborah Rose from Health Management Associates. In it, you will hear some perspectives from these members who have participated in the CARE Act on the ground, and you'll hear about their experience and some words of advice they have for petitioning to their CARE Act. So we'll now turn to that live discussion.
Good to see all of you. Thank you again for joining today. I appreciate your time. We've had an opportunity to talk recently about your experience with CARE, and I've had the opportunity to hear you talk about it previously. And so I'm delighted to just open this up with you today. And I have a couple questions on my other screen as a prompt for myself, but let me begin, and this is for each of you, is what's been your role in CARE so far?
Allison, go ahead and lead us off.
Okay, happy to start. So I think originally, so just a little backstory. I've been a firefighter with Alameda County since 2011. I've been working on the crisis unit, the alternative response unit, for about a year. So originally, when I was on the crisis unit, I didn't really know what my role was going to be like as a firefighter, as a crisis responder, and how CARE was going to impact that. So at the beginning of the year, we were introduced to CARE and the CARE Act, and we just kind of went for it, not really knowing what to expect. So once the team started to do these CARE petitions and get more comfortable, I wanted to try to file a petition as just a firefighter without the backing of the crisis unit. So I went ahead and picked a person who was very well known to the department, who I thought would qualify, filled it out myself, just as a firefighter, submitted it, and it was accepted, and it was actually a very smooth process. So that was my first firefighter experience with a CARE petition.
What was the experience of filling out the petition like for you?
I mean, it's a court document, so it's a little intimidating at first, but now that we've done it so many times, it's like a PCR. Maybe not that simple, but I would equate it to filling out a PCR with like the repetition. You know what questions are coming, you know how to answer, you know what the judge is looking for. Yeah, it gets easier with time.
It gets easier.
Yeah.
Brian? I see Brian's hand is raised.
Allison, thank you. Allison, I wanted to ask you, is it similar to the experiences that we have in the fire department with interaction with adult protective services or child protective services, or was it better and more consistent? Meaning APS can be tough to deal with in a compressed amount of time, and how would you compare the two processes?
I would say based on our experiences with CPS, APS, while overwhelmingly positive, when we go and turn this petition in person, that gets the ball rolling very quickly. And it's within a week or two that we'll get an email back with a court date for the initial hearing. So it's been easy. They've done a great job.
And then secondarily, tell us, and if I missed this, I'm really sorry. Tell us about the court date and your experience with that, and how did you handle it? How did the department handle it?
I mean, we have had nothing but support from the department with the implementation of CARE. So you'll get the paperwork back that gives you the date and the time for the pre-initial hearing. So you'll show up in person. They're working on streamlining that process. It seems like they set a time frame for all the clients to go in and see the judge. So you don't have a specific time. So sometimes you're just sitting there waiting. It's helpful if you let somebody know you're there so they come and get you when your respondent is going in front of the judge. then they'll come out and get you. It has happened where I've been forgotten, like I've been sitting there and no one came out to get me, which is fine. But yeah, it's been a really great process that they're just trying to continue to streamline.
Thank you.
Mhm.
Brian, you're certainly welcome to stay on and ask questions. I think they'll be really helpful. I'm so glad that you're here. Allison, I'm going to stick with you for a moment. When we talked, I guess last week, you shared a little bit about your experience of that first time being in court. I'm wondering if you can talk about that a bit more.
Sure. So our judge, Sandra Bean, she is a judge that signed up for this, that signed up for care. She really wanted to do this and be involved with getting folks the care that they need. She created a really welcoming environment in her courtroom. Chief and I were there yesterday, and they were pointing out these lovely quilts that she had put up on the wall to make the environment more welcoming. It's like an open door kind of situation, like no one's closed in. We have a lot of clients dealing with paranoia, and like getting them through a metal detector and getting them into a courtroom is challenging. So she's really done a wonderful job. She has coffee, snacks, water. She's really trying to take the court out of courtroom. So that's what the environment is like. It's really lovely.
And were you asked to make a statement the first time?
Oh goodness, I can't remember. Chief, were
Okay.
you there the first time?
I think, yeah, you were, and you
Okay.
you kept it pretty brief, just in support of the client and what you've seen. I think something to note too. I mean, responding as part of the crisis team involves, more services and more care sometimes. But I think even as firefighters or first responders, the person filling out the petitioner, if it's not the family, may not know a lot, but they might know the most about somebody on the street. And I think that's what firefighters need to remember is you might be seeing this person more than anybody else, even if you feel like you don't know them that well. And I think that's what's really helpful about having the petitioner there to answer some questions from the judge.
Appreciate that. Mon, you're nodding. How has it been your experience to date?
I'm just echoing everything that they're saying. Our clients come from a wide range, from running the 911 calls to the mobile crisis unit that I've been on in the last 6 months. I think we all collectively have a common feeling, though, that this client needs something more outside of just the interaction that we have with them and then them being transported. And this is kind of going back to what we spoke about the other day of just taking pride in your district and everyone that's in it. And part of that is taking care of the people that are sometimes overlooked. It's easy to look the other way, but this is breaking that cycle of this person needs to be addressed and then given assistance and help. And how does that process look like? Well, there's formal paperwork that needs to be put in, but at least now they're being spotlighted and they're recognized by the county as someone that should be reached out to and offered services. And a lot of times, all that requires is simple shelter. It's pretty incredible once you take out those portions of necessity of shelter, food, water, how they can be a little bit more trusting and speak to you, and then finding out what the root cause is. Sometimes that requires a lot of contact time, and that's why we have behavioral health with us as a companion in this to help our clients, our constituents.
So what, and for all of you then, what are some of the typical situations that you might be called into where you could be thinking about care?
Yeah, ours is a psychological event. Maybe it could be contemplating suicide. Maybe it could be someone that we're driving back from a call and it's a person that's just yelling out in the air instead of just driving straight back to the station. Well, make a pit stop, looking at them, talking to them, seeing if they are meeting the criteria. And then maybe it's not the first time that you've seen this person. Well, now we can do something about it, right? Like there's a timeline, a historical timeline that we've interacted with this client. This is an opportunity now, something that's new in our tool belt to address this. And exactly what you were saying earlier, Doctor, of we've seen the deterioration, right? Maybe there's someone new that just came into your city. Oh, that's a familiar face. Next tour, you see them again. Maybe you don't see them for a couple months, but you see the progression by their demeanor, their clothing, how their cleanliness. And it's like, okay, this is definitely now someone that we can address. Maybe we didn't get a 911 call on them, but this is something that we can offer to them. Yeah.
Yeah, I really appreciate what you're saying. The moment where you can describe what they're looking like, how they're behaving, their hygiene. You might not know what the diagnosis is, and it sounds like you don't have to. Allison, you're nodding. How has your description in petitions been received by the courts? And what do you write about?
It's been received very well. I was jotting down notes when you were giving your presentation. I was thinking about how, like, when you go to fill out the petition, like for us as firefighters, it's kind of like giving your size up. Like, what do you see? What do you have? What do you need? Like, that's kind of the picture that you're painting for the incoming units. That's what you're doing for the judge. Here's what we see. Here's what we need. Here's what, you know. So can you repeat your question? Because I go off topic. What was the question?
No, I think you were on. I was asking, what do you write about? How do you describe it? And how has that been received?
So when I filled out the petition as a firefighter myself, I was lucky to have access to the CHR, the community health record, through my coworkers. So we were able to use that as the medical backing to turn it in with my petition. I know that not everybody has that access. So if I didn't have that, you really need to be very specific about what you're seeing. You can pull up the definition to kind of get the idea if somebody qualifies. Like you don't need to make the medical diagnosis, but you need to kind of match it with what you're seeing, and does it match what the qualifies somebody for care. And as long as you list those things out, it doesn't have to be perfect. Um, and another helpful thing is to put phone numbers in there. If you have like family members or other folks who have interacted with the client. The petition I did as a firefighter, I was able to put in a couple fire captains who I know had a lot of history with that client, and they did reach out to those people for more backstory. And then the petition was accepted. So sometimes less is more, but like more might be more, especially the first time you do it.
Yeah, I appreciate that. You're just writing down what you know, and it doesn't have to be exhaustive, right? You don't have to write an entire history about this person, but you can document on what you've been describing. We've seen this person over the last couple of months, and he or she seems to be deteriorating.
Correct. Yeah.
Right.
And just to echo what Allison is saying, I know that as firefighters, we want to do the best that we can. And part of that is the application. And it can be a little bit frightening to look at this paperwork and it's like, fill this out. What have you seen? What type of diagnosis is? But keep in mind that the judge, the person that's receiving these applications, are very empathetic towards this CARE Act and everything that encompasses. And with that frame of mind, they are, again, more empathetic and understanding of everything that you're observing because we have, because of our title, because of us being public safety first responders. So,
Right.
yeah.
Right.
Yeah.
You carry a lot of weight in your community.
Correct.
I was
Please.
just going to add something, especially when we were there yesterday, and I'll just say, Care Court is really becoming more and more on the radar. The Attorney General was coming down yesterday to see what Alameda County was doing, and really taking a look at the Care Court success. But one of the things, I know it seems daunting, but start those 2 petitions, get the ball rolling, and build those relationships. I think from more of an administrative side too, and our team has done this at the ground level. Allison and Mon and they know the public defender now. They know the judge. They know the team that's offering all of the other support for us. It's Bay Area Community Services, but all those main players, they huddle and they're all in there for the same purpose. So I think just starting that learning curve of submitting petitions, talking to those people, building those relationships really goes a long way. I mean, they see who the petitioners are now, and they trust our team and our folks submitting. So I think it's, and it really does open the door to so many other services, even if it doesn't go, it can go many different directions, almost all of which are leaving the patient and the client better off than before they were enrolled. So don't be shy.
What a great takeaway message. File 1, begin the process with a baby step, if you will. Paige, you're talking about working with essentially law enforcement and the courts, beginning that relationship. What are some of the community groups that you've been working with through this process?
Oh gosh, I'm gonna let the team roll with this. There's so many. The big one for us in care court specifically is BACS, Bay Area Community Services. They're the main partner with the court here in Alameda County, but they
And
refer.
they're an FSP program, right?
Yes.
Yes.
Okay.
Yeah. And so if they're not directly placing folks, I mean, I could rattle off a ton in this county, but Allison, you want to name some key players? I'm happy to jump in with what I know. Ramon.
Yeah, well, Bax is obviously the first one that comes to mind. I mean, we work with San Leandro Police. Our relationship with them has really
Yeah.
blossomed over the last year. We work with Abode Services. Oh, Mon, help me, I'm on the spot.
Yeah.
We
We're going
don't
with
need.
county. Yeah.
Right, and that's okay. I don't want to put anybody on the spot. I'm really thinking about what types of organizations, and it sounds like you're talking about FSP teams, which are case management and outreach teams, working with other law enforcement professionals, with the courts themselves.
Yeah.
Yes.
Yeah, what you're
Yep.
saying, Dr. Rose, is that full service provider. And so you're dealing with a lot of entities, but it makes it easy because once you file the petition, there is a social a case manager, and that becomes kind of like your point person to, okay, anything dealing with this patient or client, I'm going to refer to her because she has her whole team. And so exactly what you're saying, once you filed it and you have a point person to speak to, it makes it a lot easier of like, okay, if I deal with person X, I'm going to call person Y, and that issue or whatever's happening that day is being addressed. And so you feel a lot more comfortable and at ease that this person is receiving the help instead of like, well, I don't know now. This person could use all these types of resources. Well, no, you get funneled into one person, and all that is corresponded from the email or letter once you submit the petition. It's like, this is the person that's going to be in charge of your client that you petitioned for. So it makes it easier.
So I'm going to shift a moment. Have you had the experience of working with family members? How do you inform and educate them about care?
Families are, yeah, that one's interesting because you have families that are like, man, I've lived with my daughter or son or aunt or uncle their whole lives, and we are at our wits' end and we don't know what to do. That makes it pretty easy. You put in care. The other one is you want to empower the family to petition for the family member, but a lot of times it just doesn't happen. And so you kind of have this power struggle in between, okay, now do I petition for the family or do I allow them the freedom and autonomy to file because they know their family member better than we ever will. And at a certain threshold, you're like, I'm just gonna have to put it in for them, and tell the family member, of course, like, okay, it's been a while. I'm going to do it because obviously we're just not wasting time, but this person needs resources like last month when we first interacted with this person.
Interesting. And other folks are nodding here. That's a lot of responsibility and a tough decision to make.
Yeah.
So if sorry,
Please.
if I can piggyback off of what Mon was saying, one thing that we started to incorporate on the crisis team, which I think will be really beneficial for our department and neighboring departments, really any department, is we tried to make this firefighter proof for the families. So we put together a packet, and I have one. I just happen to have one in my lap. And in the packet we have our business card. And then we also put the address of where to send the petition on an envelope to give them and be like, you just got to fill it out, put it in here, slap a stamp on it, send it in. Because families are going through a lot with their loved ones in crisis. So we wanted to make this as easy because the petition is intimidating. We give them a handout from HHS explaining what care court is. We give them a blank petition. And then my personal favorite, the how-to guide, which I still use to this day, just to help them. If we're not there with them on scene to assist, at least they have something when we're not there to refer back to. And we've actually had a lot of success with these. And I'm pushing it hard right now because I think it really works, and that's an easy thing we can all throw on our fire engines.
I love that. That packet is perfect. I do want to quickly mention that one thing that can also be provided to family members is the self-help centers in communities. And these are run by the Judicial Council, where they can provide some legal guidance. They're not giving legal advice, but they can also help the families to complete a petition. But one thing, Mon, that you said, which I appreciate, is that sometimes it's very difficult as a family member to make that kind of decision to file. It might impact the relationship, which is probably already a little bit challenged. And so you're able to afford the family something that maybe they're not able to do. So let me, with a couple of minutes left, I want to ask, what impact have you seen on people in your community? How have individuals benefited from the work that you're doing with CARE?
I think the biggest impact we've seen is the rapid allocation of resources just thrown at somebody. The court backs our full service provider. They are so motivated and so dedicated to get these folks the care they need, the meds they need, and housing. Like, they show up on day one with a 2-week voucher to get somebody off the street. So to go from being completely unhoused to being offered a 2-week hotel voucher is huge for these folks. And we had a client yesterday or the day before, we were with San Leandro PD. She said, "Wow, I've never received help like this before." And that's sad, but also it's like, well, good thing we were there, because now the trajectory of your life has just completely pivoted. So that's been what we've seen, and I'll let the others chime in.
Yeah, it's another tool in the tool belt that we can utilize now for a segment of the population that I felt like before maybe we're just lacking in the amount of resources that we're able to give them. And so now it's, you see a picture of a person that needs the help, you have a tool that is very appropriate, that doesn't have, it has short-term effects, but it also has long-term help and assistance. And it's like, that's where we want to get them, a place where they can enjoy their lives, maybe have some type of normalcy, or they're back to normal. But it's like, you can change the trajectory, exactly what Allison is saying, just by offering them Care Court. That's pretty powerful, very powerful.
I'll just also add, I think those are the best stories when we ultimately are helping the client in need. But I do know, we definitely have cities where we have some really chronic folks that are disturbing the residents around them or the businesses. And for sure, direct care court petitions have made a huge impact on a couple of those clients. One, just filing the petition itself, I think the client and their family at that point sought some services on their own, and it was no longer an issue. It was a huge issue for the community and the neighbors, and it became a non-issue with that care court, petition. And another one, did end up in conservatorship ultimately. And that's not the goal of care court, but it is one of the outcomes. And that might have been what was needed for that individual. That was definitely a concern for the community in the business area, to get him better help than what was going on and affecting the businesses downtown. So there's just been so many different examples of where these petitions go.
Thank you for that. You can't see, I have some goosebumps over here from the impact that you're having on individuals and families, on the community. And I want to thank you for what you're doing for your home. Don't go, stay where you are. I think what we're going to do is we're going to open this up to some Q&A. I also see Brian is there. He might have some, I'm so happy that you're here because I think that you will have some Q&A and comments that would really benefit the group. And so with that, I'm going to ask for some assistance if we have Q&A that's been coming in. We also are very happy to open it to if people want to come off of mute or want to come on camera or call in. We are happy to take those kinds of questions as well.
I'm not sure, maybe you guys could speak to this in terms of the judge ordering more than the FSP can provide. I don't think they have such a good relationship. I think she never tries to push further than what they can offer. I think we're lucky in this county. We have everyone wants more resources and more housing. We probably have more than most. But I think she works with facts and everyone else not to bite off more than they can chew. But that's a guess.
Other questions? Brian, is your hand raised?
It is
Great.
for both Allison and Mon. Are you seeing individual engine companies within Alameda County beginning to make these reports or do those follow-ups, or is it for the moment contained just within a specialized unit? And then I have one comment. Your comment about returning to quarters and seeing an issue and stopping. I want firefighters like that in my neighborhood. I very much appreciated that. And I have a feeling that's both of you. So that's just well done.
Yeah, Brian, I just got off the alternative response unit in the past few weeks. And so what Allison has experienced in the last 6 months as a firefighter back in the station, she is now going to be on the unit. And a lot of it is just education, right? Now I'm educating my crews of what we can do for our constituents. And hopefully, actually a little backstory is that towards the end of my term on the unit, a lot of our engines companies started calling us out because they've identified that this is an alternative response unit call. And so from there, I can only imply that the next part of the education process is not only can we go on the call, we can do something for them long term. And a lot of that is, I can only impact the people that I work with immediately, and then hopefully that ball just gets larger and larger where it becomes norm.
Are you beginning to see buy-in from companies across the county?
The count.
It's slow. Is that it?
I think that's on me. That's on us as chiefs to implement some training for our folks, across the department. I think we started off with this alternative team, and they've just really run with this, and they've run with Care Court. And now I think, Allison's absolutely right. We need to do a department-wide training, task force training, medical services, put it out there. Let's get everybody through. Hey, we can offer something else for our clients, and we can do it from our fire engines. So that's probably what we're going to be looking towards in the future. And I think what these two would probably recommend as being on the front lines to be the most beneficial. But correct me if I'm wrong, guys.
No.
You have done a lot in a brief period of time. And so this is the beginning of the path of continuing to educate and promote what you've learned with others. I
Absolutely.
think that Jane's hand is raised. If you want to come off of mute.
Hi, everybody. My name is Jane Souza. I'm with the City of Santa Clara Fire Department. We have a team on here. We're in the Community Risk Reduction Division. And so we have several people on here that we are responsible for public education and community events. We do some health fairs and different community events. Am I correct in understanding that anyone can file a petition on behalf of someone?
Great question. Not anyone can. For example, a neighbor would not be an eligible petitioner. First responders are eligible petitioners, family members, hospital providers, doctors, and we can probably, my colleagues within a few seconds, I bet, will be able to put that into the chat of who the list of eligible petitioners are.
Okay, perfect. Because I'm just thinking this might be something good for us to include in some of our community outreach, public education information.
And we have plenty of material, education, flyers. In fact, I'm going to turn it over to my colleague in one moment to talk about what some of those resources are. And so certainly who is an eligible petitioner is included in that. Great question.
Great, thank you.
So we only have a couple of minutes left. From my heart, I want to thank you for everything that you are doing, not only for CARE, but for your community. You're just so impactful and so appreciative. And thank you for taking time away from that to join me today and the other colleagues. Patricia, I'm going to ask if you can come back on. I'm going to pass it off to you. Allison's got this packet of great resources. You can fill it out even more. Thank you again for today.
So now we're going to jump out of that live discussion to share a few resources available to fire service members. First off, we have the Care Wallet card. If you go to, you see a visual of what this card looks like. You can go to this resource on the Care Act Resource Center. And it is meant as a resource and a quick reference and outreach tool for care in the field. It's printable or savable as a photo on your phone. It includes both information about care, some QR codes linking to some petitioner landing page or county-specific care directory. Could be used when you're on the ground connecting individual or a family member, or distributing to a family member, hospital staff, or other first responders to know about care and to figure out how to take next steps in petitioning. Counties also received a template that they could localize. So if you're interested in having county-specific resources, contact your county behavioral health for a community-specific version. There are a couple other resources we wanted to let you know about. One is psychiatric advanced directives. So we have a training posted to the Care Act Resource Center about what a psychiatric advanced directive is, what it is, and what can first responders do, and what should they know about. So go ahead and check out that resource on our Care Act Resource Center. And then if you're wondering where these resources are, they are housed on the Care Act Resource Center. We have a number of training and resources. We list upcoming trainings, have a county directory if you're wondering where to go in your specific county, and it includes a number of ways to get in contact with us. We wanted to note in both the training and the resource page, key materials are pinned to the top, and these include some recommended foundational trainings for the Care Act Resource Center if you're interested in learning more about the basics and about your potential role in petitioning individuals to the Care Act process. There really is no wrong door, and we are here to support you and provide you with opportunities to connect and hear more about implementing the CARE Act. Our website is careact.org, but you can also reach out to us at info@careact.org, and we can look for the right resource or point you in the right direction. Please let us know if you have any questions.